I'll go ahead and do your depression and anxiety screening for the year. Have you noticed an increase in your anxiety or depression over the last few weeks? It's kind of out of your norm.
Yeah, because I didn't have my medicine and I was anxious about why I couldn't get a phone call from y'all. I had to actually call the front desk after leaving multiple messages for the nurse, and the front desk had to go and take care of my prescription.
I refilled your prescription. I think it was on Friday. They came back and told me that was the first I'd heard about it. I hadn't gotten any calls or notifications until then.
I left voice messages on the line
It might not have come
several times because I either see her or I left the messages.
I didn't get anything. It could have gone to somebody else. I don't know. I didn't come back.
Yeah, so I went almost a week without it.
Besides that, when you were taking it consistently, did you feel okay? Did you feel like your anxiety been increased recently, or?
That was fine.
Anytime you need anything, for me, it's easiest to see, like, somebody message to that, like, and it goes directly to where it's supposed to go, directly to the provider that you used to see, so there's no chance of me not getting the message. I'm not lying to you, I really did not get anything about it.
No, I mean, that's fine.
If you ever need a refill or need anything, message for that, because I'll get it directly. Like, there's no chance of us missing that.
I get that, but that's after the fact. I already been without it. So, you know what I'm saying?
I'm just trying to make it better so that it doesn't happen again.
In the midst of it all, if y'all are getting messages here in this clinic, so that just may be a whole clinic thing. I don't know. But,
I'm trying to make the situation better so that it doesn't happen again. I didn't have anything to do. I just want you to know that, and because I would have refilled it, I would have gotten through and done everything we needed to do.
And that's fine, but in the midst of you saying, even if I message, by the time I message up here and I'm supposed to wait to hear back, in the midst of waiting to hear back, it's just bad office behavior. I don't know what, you know what I'm saying? I don't know what else to say about it. It just, I get what you're saying about this portal thing, but it's,
I'm just saying for future reference, there's no, like, I can respond quicker and see it quicker if you send a message on the portal. So, I don't know who would have gotten the message, like a voicemail. But for me, whenever I'm going through and doing stuff, if I have it right in front of me, then I get it done quick.
So y'all don't listen to the voicemails when people call?
We do. I do.
Okay. Because I left about 3 of them.
Yeah. I don't know. I did not get one. Some days are hectic. We don't get to answer them until a little later in the day.
Mm-hmm.
But if you leave a voicemail and don't hear back for 2 hours, send a message to the portal. And it might be, I might not get the voicemail until later that day or whatever it may be. But it will not be missed if it's through the portal, whatever it may be. So that all of our bases are covered.
And that's fine. I'm not necessarily just worried about me, but I know you probably got patients. I'm about to be 45. And I'm sure you got patients older than me that are not going to be able to get on a portal. So y'all need to figure out what's going on with your voice system.
I know.
Like that.
Like, that's fine. I'm just trying to make it better. That does not happen often. I don't know what happened.
Yeah.
So that there's nothing.
So yeah, just relate it to the office like that. You know what I'm saying? Like, I'm gonna be just fine, but
I can promise you.
I'm sure y'all got a 60-year-old patient that may be waiting on some medicine.
I can promise you we try to take care of everything we can. I just want you to know that.
Yeah.
I don't know what happens, but that doesn't normally happen. I don't know what happened, but it will not happen again.
Okay.
Because I've gotten it. I've been done.
Okay.
But I let me make sure.